Good morning to you. A few features on technology. Welcome to our first class. And in the introduction, I help you go through an overview of what I expect out of you, even as you join these community of community health practitioners and the ZTech community. What is expected of you as a learner as you do this course. Now, today we are supposed to look at our first topic, which is concepts in community health. In this course, we have several topics that we shall cover. We shall cover concepts in community health like definitions, importance of learning community health and such like. We shall do health education, like find out different methods of health education, what it is, and how we can integrate it in terms of ensuring that the communities have good health. Then we shall do introduction to home-based care. Just a bit of information on home-based care because it's the care given to people who are terminally ill, and it has previously and commonly been given to people who are HIV positive. But right now, because we're having other scourges like cancer, we are having diabetic patients, especially cancer, and because it's a disease that keeps depleting the body, sometimes patients prefer staying at home and just getting medical treatment from home, whereby we have a team of practitioners who check on the given patient while at home. That is why it's called home-based care. The treatment is administered at home. There's maybe a few hospital visits, but majorly the person could be bedridden. So there's more about the patient being taken care of while at home. There is a nurse, there has to be the other caregivers present who are informed on what to do. There is a doctor who keeps checking on this patient. Yeah, clinician, yeah. Then we shall also look at substance abuse, like reasons as to why people engage in substance abuse and how it affects health of individuals. We shall be able also to delve into matters nutrition a bit, just to know issues of food security and how we can ensure that it's fully supplied to communities. People are getting enough, sufficient food that is nutritious for them for proper living. We shall look at different levels of food security and also food handling. We shall be able also to cover aspects on immunization. Remember, immunization in children is very crucial. There are immunizable diseases that are actually preventable. Immunization is a way of preventing diseases that can be detrimental and cause death, infant mortality, and child mortality. So we want to bring this down and learn more about immunization, then growth monitoring and promotion, and also cuts and assignments are part of what we shall do. I said we have 2 cuts, each carrying 15 marks, 2 assignments, each carrying 5 marks, and then 1 main exam, 60 marks. But alongside that, I shall take attendance, which shall carry some amount of percentage that shall be summed up with the cuts and assignments. An average will be done on that, the attendance, the quizzes, and other activities that we shall engage in. So be on the lookout and be cooperative even as we begin this course. Now, today we want to look at the first topic on basic concepts used in community health. And as an introduction to these, we have it that in this first topic of this course, it examines the common terms used in community health, for example, community mobilization, resource mobilization, health, etc. And the objectives are that by the end of this unit, by the end of this topic, as we learned today, we should be able to define the terms community mobilization, resource mobilization, health, community diagnosis, teamwork, and also community health. You should also be able to explain how community members can be involved in the promotion of their health, identify their key community members who can promote community health, and also describe the factors that affect the health of a community. Now, even with these objectives, I think what rings in your mind is this, that communities have different challenges. There are those that could be a bit common, but usually communities have challenges and the members of the communities have always possible solutions. It's always good to involve communities so that they're able to know what best to engage in or what best to do so as to keep achieving maximum or optimum health within the community. Now, community health is just part of medicine, which is concerned with the health of all population and the prevention of the diseases. And the population refers to all people regardless of age, sex, socioeconomic status, race, ethnicity, or nationality. So whenever you hear the term community health, basically it's part of medicine. So you are actually going to be in the medical field, whereby you are going to become a community health practitioner. So it's a part of medical science or medicine, which is concerned with the health of all population. So you're going to be concerned with the health of all population, like in terms of age, whether they are children, whether they are pregnant and lactating mothers, whether they are the elderly, whether they are the disabled, people of different races, nationalities, socioeconomic status, whether rich, poor, people of middle class, low class, both male and female, whether Kenyan or non-Kenyan, you're going to have information that will help you deal with the health of all population and the prevention of the diseases. So maybe a major focus will be on the prevention of diseases amongst populations. It does this, community health does this by conducting individual and community diagnosis, discussing the prevention and suitable control methods of diseases, prioritizing felt needs, use of available resources to combat diseases, and working together with the community. Felt needs are based on the assumption that at the heart of any problem, there must be an underlying need, and these needs usually stem from the members of the community rather than from the health workers. So usually health workers are likely to look at just the felt needs, like what they feel like is the problem here. But the community itself has information about their real needs, like what do we really need? This is what we need as a community. This is what will help us as a community. When you get 1, 2, 3, maybe assuming boreholes or latrines, or we get, what else do communities need? Maybe major resources, yeah, they would appreciate, and they'll know that that will solve their problem. So since a number of health issues can be noted in an area, it's important to prioritize them, and this is done by identifying the most pressing needs of the community and starting with them. So much as we'll identify the felt needs, you need to find out the real needs, like what is number one. You prioritize them according to need, and then you give intervention according to the same. So with this, we shall do them, starting with them, using the most affordable and effective methods available. So we need to do planning, which means deciding on priorities. And community health requires the following one: more preventive medicine. For example, immunization, as I'd mentioned. Personal and environmental hygiene is very crucial. Like right now, what you're doing in this season of coronavirus, you find that there's a lot of information on personal hygiene and environmental hygiene. Like let's ensure our surfaces are cleaned up every now and then. Let's ensure personal hygiene by washing our hands, coughing or sneezing in our elbows, ensuring that you cover your nose and mouth with a mask. You reduce social distancing. All this is about personal and environmental hygiene. Then special coverage for those at risk, for example, expectant mothers and the under fives, which are usually at risk, and even pregnant, the lactating mothers. Then delivery of primary health care for everyone. That is a crucial thing, because every person is entitled to health services, and we are all supposed to acquire them and use them appropriately. So in primary health, usually with this care, it should be one, accessible, so that it's easy to reach by the available means of transport. A suggested figure is that of one hospital per 10-kilometer diameter. But is this practical in our country, leave alone other countries? In Kenya, do we have a hospital after every 10-kilometer diameter? You'll find that it should be done, because we have so many resources with us. Like right now, we have a devolved health units within counties. They should be able to allocate money. They should be able to construct, even if it is dispensaries, because that's the lowest level where the community is able to get medical assistance. Dispensaries. Then we need to have health centers. Then we need to have at least level 1 hospitals, level 2, level 3, level 4, then level 5. But is that the actual case? May not be. But it has to be accessible, because remember, when a hospital is far away and you need to use maybe like 500 shillings to and fro just on transport alone, you don't have maybe money to spend on some snacks or some food, because you may spend a lot of time in the hospital. So accessibility is very key, you know. Then affordability, one that the patient can financially be able to cater for. Like there's sometimes costs that are incurred within the hospital. Some public facilities, when you go there, first you'll pay maybe consultation of 50 shillings or 100. Initially, there used to be a lot of money, but the government really subsidized, and therefore, we find most hospitals will just ask you to get a card at 50 shillings or 20, depending. I think 20 for children, 50 for adults. Then when it comes to the lab tests, you may have to pay for them, the laboratory tests, then medication. But for children under the age of 5 years, most public facilities do it for free, so that we encourage, we discourage child mortality and we encourage children to live many years. So it has to be affordable, because even if you get, yes, checked by the doctor, you'll do the consultation, you'll be checked, but then you don't have money to buy the drugs. How will you survive? Because yes, you know where the problem is, but there's no money to get the drugs. You go to private facilities, mostly there's a consultation fee that you really have to pay. And again, with these, it could not be affordable to people of low socioeconomic status. The third aspect of primary healthcare is that it should be acceptable. It should be delivered in such a manner that emerges with community concepts. So it should be delivered in such a way that people within that community accept it. They are for it. They know it. They understand it, you know. There's a time, there's a story that was, it's not a story, it's an actual event that happened. Vitamin A supplementation was being given in a certain community to pregnant women, to lactating mothers and to children under the age of 5 years. So upon reaching this community, some men formed barriers to this intervention, because they felt like these people, their women and their children, were being given contraceptives in the name of vitamin A. So they disputed this action by the government, and that specific NGO that was doing it had to halt this plan. And remember, vitamin A is a key deficiency disease in Kenya, and it has to be handled with care, as in it should be given that concern that it needs, because it's a public health issue. So the program had to be halted. Another one, there's an NGO that was conducting biochemical tests of blood to check the iron levels of the community. So remember, with iron, again, we do have the iron deficiencies. Iron deficiency anemia is quite common. It's quite common in Kenya. It's a public health concern issue. And again, as they were drawing blood, people started saying, hey, the devil worshippers in this community, they have come, they're drawing blood from people, and then they take it away, they go to drink. You see, the blood samples, usually the field, will be taken, will be kept maybe in the freezers, so that it's transported to the laboratories for testing to know the levels of iron or whatever thing that is being tested. So unfortunately, again, this was hampered, and therefore, we are just saying that now with community health, members have really to be equipped. They have to be really knowledgeable. They have to be informed. They have to be aware of what is actually happening, so that they don't speculate, they don't suspect, and they don't form barriers to that given intervention that is being given to that community. Now, let us look at some few common terms that we use. The first term is community. When you hear of community, what comes to your mind? Yeah, I think you're right. It's a group of people living together in one common geographical area or locality. So basically, a community, there are those groups of people, a group of people who live together. Common geographical area means these people could have shared resources, like water resources. They share the same market. They share the same, what else? Communities. They could share the same churches, other amenities, hospitals, health facilities. So these are community. And when people are together, like in terms of like ZTEC, yes, it's a ZTEC community because all of us are there for the purposes of learning. So we have a common goal and we have shared facilities together as we learn one another, as we learn through the system. Then we do have community mobilization as a term, and this is a process of bringing people living in one geographical area, location for a common goal or purpose. For example, to fight an epidemic like HIV/AIDS. Now, with community mobilization, you're going to bring people together. It's a process. You mobilize, you get people together, you let them know an importance of something, an aspect. For example, if it's a fight against like HIV/AIDS, it's remember we're talking about people living in one geographical area location for a common goal or purpose. So as they are there, you could educate them on like the HIV pandemic or epidemic, like help them know how is it transmitted, what are the negative effects, what are the detrimental effects that results from the infection, and what are the end stages, what are the effects, psychological traumas that people go through, both those who are affected and infected, So it's mobilization, and you may need to educate these people. You may need to test those who are willing to be tested, because it should be a voluntary process. After testing, those who test positive should actually get maybe prophylaxis like septrin and multivitamins. Then they need to be monitored like through a monthly basis or after every 3 months, so that their CD4 cells are checked and the viral load is monitored, so that it doesn't increase so much, So it's actually a process. Have you understood? I do hope so. Then we have resource mobilization. And this is now a process of bringing materials. Remember resources. It could be in terms of human beings. It could be in terms of money. It could be in terms of time and such. So it's a process of bringing materials, time, and manpower to achieve a common goal or purpose. If you want to do, assuming like you've gone to a certain community and you realize that one of the biggest problems is that they don't have latrines. Mostly they use the bushes, they go dispose there, their waste, and then they leave. With that, they could start being developing bacterial diseases. And as it is, like cholera outbreaks are common, dysentery and such, like if there is maybe the feces going into the water, that fecal matter. So there has to be that mobilization of the people so that they can be able to provide manpower. They could be there themselves, they offer themselves, because once you're conducting the needs assessment, whereby you get to realize these are the daily needs, these are just the felt needs that you could give them a priority, but not as number one, that those will be like, yes, I can be available. My son can also be able to do 1, 2, 3. We'll dig the latrines. We'll provide jembes. Others will say, I'll give out my wheelbarrow. Another one will say, I'll sacrifice these and these. So in terms of finances, time and manpower, that is very crucial. So NB, mostly resources we refer to the 3 M's: material or money, manpower, and minutes in terms of time. Then health. What is health? According to the WHO, health is basically a state of complete physical, mental, social, and spiritual well-being, not merely the absence of disease or infirmity. Now, when you say a state of complete, that one should actually be underlined. Underline that one. A state of complete physical, mental, and social well-being, and also spiritual well-being, and not merely the absence of disease and infirmity or infirmity. Now, what is infirmity, or how different is disease from infirmity? Disease ni ugonjwa, that has symptoms, You could be feeling nausea, you could be vomiting, you could be feeling a headache, you could be having fever, you could be having stomachache or backache, you could be having some pains in your legs, you could be having some pains in your shoulders, chest pains, the list could be long. Those are symptoms. Those are signs and symptoms. Diarrhea, constipation. When we come to infirmity, it may not really have symptoms and signs, but it's already an outcome of something that happened in the body. Mostly it is a malformation within the body. It could be an arm, maybe one doesn't have arms, or has one arm, or is missing a finger or two, feet. Maybe someone is lame, doesn't have feet. One could be blind. One could be deaf or mute. That is an infirmity. Are we together? Yes. So you may be missing out on all this, that you don't have any infirmity and you don't have any sign of disease. So with all that, you don't really, according to the WHO, we don't give you a clean bill of health and say that now you are healthy, you're in good health. Because you're saying it's a state of complete, there has to be all these aspects encompassed: physical, mental, social, and spiritual well-being. They all have to be covered. So with the physical, excuse me, with physical, it's about the physical body. Like you don't have any if deformity, you don't have any pains within you, you're not sick. The one that we commonly say that I'm not sick, I'm okay. Mentally, it's about issues to do with stress, depression, you know. Look at people who are mad. We actually mostly they'll be taken to Madare or some other centers that will handle mental illnesses. Why? Because such people, we feel that there's something wrong within their brain system, within their mental system. They're not able to reason as it should, logically, and be able to do things consistently. So mentally, if you are feeling so stressed out or feeling depressed, then other aspects could be okay. Yes, you are okay, but with this one, because you're not okay, then it's not complete. So we'll say actually you're unhealthy. With social well-being, socially you should be able to socialize with other people, share out. You should be able to cooperate in terms of teamwork. But you see, if you're antisocial, because there are those people who are always into themselves, leave alone introverts. You can be introverted, yes, but then you're a team player. You can be able to talk with other people, even if it's just greeting. You can say sorry when you hurt others. So if you don't do those things, then we will say you are antisocial. So that means you are sick. Spiritually, again, there are those people who go to churches or mosques, who engage in prayers, who engage in church activities or those religious activities. Okay, maybe I may mention more about church because I'm a Christian. So with that, you'll find that spiritually, there's a study that was done some years back, and it was discovered that those who went to church prayed more and had time to go to the services and listen to the word of God were less stressed compared to those who are not going completely to churches. And this basically would mean that, when you go to church or that place, religious place, whoever is leading you, whoever is preaching to you, whoever is encouraging you will leave you encouraged. As in, you'll have that hope for tomorrow, because you'll be encouraged and told, what, you can make it in life. Today you may be lacking, but tomorrow, your tomorrow can be greater than your today. You can make it. It doesn't matter the pains that you're going through today. It doesn't matter the lack you're going through today. It doesn't matter the school fee that you're struggling with today. You can trust God and things shall work. It doesn't matter how struggling how you're struggling to understand this cause. Yes, you shall make it. That is encouragement. And with that, you will live encouraged, and through that week, you'll have something to linger on, a hope to linger on, to cling on. And with that, as it lingers within you, and you keep that hope going, you're able to become stronger even in your faith and your entire well-being. So with that, it makes you completely okay. So when you're physically, mentally, socially, and spiritually okay, then we'll say that you are healthy according to the WHO. Then there's another definition about community health. And with community health, basically we say that it's the state of good health of a community. The state of good health of what? A community is brought about by one, preventing diseases. Maybe before we go through all these aspects of the state of good health within a community, do you remember what you said a community is? Yes, we said a community is what? Yeah, we said it's a group of people living together in one common geographical area or locality. And in a nutshell, I said there are people who will share same resources like hospital facilities, health facilities, markets. They'll share the same churches or places of worship. They'll share maybe same water resources. That is a community. Now, we are looking at community health, and now we are defining the term community health. And we're saying that this is a state of good health of a community brought about by three major aspects. One of them is preventing diseases. So the health of that community is actually based on prevention of diseases. So once diseases are prevented in that community, they're likely to be healthy. They're likely to be in good state of health all round, physically, emotionally, that is mentally, socially, and even mentally and spiritually. Then promoting life. Everyone is there to encourage one another, to ensure that all is well, and to ensure that they do what needs to be done to help prevent spreading diseases from one person to another, and other diseases in the community like malaria, TB, HIV/AIDS. People become more responsible. The other nutritional related diseases like diabetes, cancer, hypertension, cardiovascular diseases, yeah. And the other aspect that is a key pillar for the good health in the community is what? Promoting health through organized efforts for sanitation, control of communicable diseases, educating individuals in hygiene, early diagnosis and treatment of diseases, and also development of social machinery to improve community standards of living that eliminates diseases. Now, we have another term that we need to define, teamwork. And teamwork, there's someone who's training us in another training, capacity building, and was telling us that the word team is this acronym that he formed. Team means together, everyone achieves more. Together, everyone achieves more. Yeah, this actually was a team building organized by the ZTech University to the staff. And I got this and it has always lingered in my mind. And I'm like, yeah, truly, if you're able to work as a team, together everyone will achieve more. Everyone will carry home a certain package. And that package is like it will benefit all of you who are working as a team because you have the same goal, you have the same focus, you want to achieve same things, as you work through that, you are able to cope. So with teamwork, it's just the bringing together members of organization, community with different experiences, backgrounds, roles to work together towards a common goal. So together everyone achieves more. You're bringing together members of an organization. It could be like ZTech community. It could be like your workplace, people coming together, or at home as a family, you need to work as a team. Now in the community, we want to bring up together many people, different families, people who are working in different professions, bringing together members of organization, community with different experiences, backgrounds, and also roles to work together towards a common goal. So the common factor here is a common goal. We all want to achieve a common goal. So that is our driving force. And every day we want to strive towards that. So teamwork in community health is very crucial so that we achieve the goals that we set. We do have community diagnosis, and this is a process of assessing the community's health needs with a view to improve the existing problems. Process of assessing community's health needs with a view to improve the existing problems. So there could be problems that are already existing and you want to find out their solutions. So as you delve into what has caused these problems and how to go about them and how to bring a solution to them, it's important to assess those needs so that you are able to improve the existing problems. It involves a survey to analyze the needs of different members of a given community, different age groups and sexes, health, facilities, infrastructure, etc., and analysis of the findings and possible solutions. So diagnosis, you'll first go to the community, like you get to your community or where you work or that hospital. But basically, we're going into the community and you're going to engage with the community gatekeepers. Who are the community gatekeepers? I know you're thinking of, okay, we don't have a gate for a community, but it's imaginary because every community has the people that understand it and its needs, understand how it functions, understand their problems, and even there could be solution makers. So the gatekeepers in a community are like the chief, the security officials, the religious leaders, their community gatekeepers, and they have knowledge of information, even village elders, the community health workers, especially those who do the community work, like the CHOOS, that is the community health extension workers, and the CHVs, the community health volunteers. They do a lot, and they understand this community and the problems that these members face, and could be having possible solutions to the same. So you do an assessment. It's important to have such like people, have a meeting with them, then let them mobilize other members within the community, call for a meeting, let them air out their problems without these gatekeepers maybe being present, but at least having a permission from them to access the community. Let them share their issues and see what could be a solution to their maybe issue. Probably it could be latrines, it could be a water point, it could be food related issues, So we want to improve what? Existing problems. So here we analyze those needs, and then you prioritize them from different members of that community. You analyze, you prioritize, and then you see the needs that are there for different ages. For example, under 5 children, what is their greatest need? Is it that they are not being fed on micronutrients? Is it that the hygiene and care is poor? Is it that in this community, the pregnant and lactating mothers are the ones who are majorly at risk? Are they the elderly who are at risk, or are they people who have chronic illnesses that are greatly at risk? So it's important to do an assessment and find out the ages affected. Then the health facilities present, and what do they offer? Is it that this community just has a dispensary, or it has maybe a dispensary that is accessible, a health center, level 1 hospital, or up to level 3 or 4 hospital? As in, what is the nature of care given to the people in this given place? And the infrastructure, like in terms of the roads, in terms of the markets, in terms of the water resources. Yeah, so you do this, and then eventually do an analysis of the findings and possible solutions, and then do an intervention. So that was basically definition of some terms. We've done 7 terms that could be important for us to know in terms of this course. You can take a breather a bit, relax, stretch a bit. Yeah, as we get to finishing this topic for today. Now, I want us to look at concepts in community health, and they're not complex concepts. There are aspects that are common to us, but maybe just in terms of grouping them is what we shall do today. So the community is made up of essential subsystems which interrelate to bring about the overall functioning of the community. And they also determine the community's health, both directly and indirectly. So in a nutshell, we want to look at the different subsystems that have been classified to ensure that communities meet up with their health needs and their problems are solved, or other solutions to their problems are found. So they do interrelate. That is the most important thing for us to note today, that with these different subsystems in the communities, do what? Interrelate. So to interrelate is like they support one another, or rather they get into one another, they interchange, or rather they go hand in hand. Now, the first subsystem is social cultural system. So remember, every community has its own cultural system and the way they do their things. For example, you get to a community where people don't take boiled milk. Like I think it's a bit common in Masai, though nowadays they're getting educated, but they're the kind of people who've been taking milk like straight from the cow. They milk it and they take it raw as it is without boiling. As soon as you've gone to such a community, what will you do? Maybe you'll tell me next time. So influences in of social cultural systems, actually they do influence the lifestyle of community members. That is their priority, attitude, and values towards illness. So remember that those cultural systems that don't advocate even for their people to go to hospitals, that those that do female genital mutilation and even lack of male circumcision. So with such, it could affect the health of the given communities. The second subsystem is political system. You'll find that usually politicians or the political system is supposed to come up with policies that would help in many areas, including in areas of health. So this system has the responsibility of providing leadership in the development of the health and health-related laws and policies. And therefore, you'll find that it is the one that will come up with policies such as like, how will children be treated? What about TB? Is it that it's spreading because people are unable to afford medication? Is it that the pregnant and lactating mothers are unable to get sufficient nutrients for them to breastfeed properly, and yet they are nutritionally insecure in terms of food insecurity? What about the voluntary testing and counseling in HIV? Is it free or is it paid for? So the political system has plays a big role in terms of making policies in line with such matters so that it's able to promote good health in the community. Then we have economic system, and with the economic system, it's more about the government's ability to provide health and other services to its citizens, and this depends on the state of the economy. And you'll find that usually the poorest economy, um, when the economy is poorer, the poorer the economy, the more disadvantaged the people that stay in that given economy or that given country. So that tells us that low economy status is the leading cause of malnutrition and the communicable diseases. And that is why you'll find most of these developing countries are still grappling with that. That is an issue that is not a big issue. It's almost an issue in developed countries. Yeah, then educational system is our fourth subsystem. Education is the main tool of changing behavior and improving individual and community health. So when you have low educational status amongst people in a community, it perpetuates underdevelopment, harmful traditions, and superstitions. People will live in superstitions. Like when the HIV scourge came, like in Africa, people started believing, like, yes, this is the origin. It could have originated from monkeys, from chimpanzees. Then it came to human beings. Then it started transmitting from one person to another. Some believe that they're like demons. Others believe that, people have many beliefs around it. The cancers that those people who have beliefs about them, like, this is witchcraft, this is what. So if people are not educated and they're not aware, they're not knowledgeable about such facts, like what brings about cancer, what causes HIV, then they're likely to become superstitious. They're likely to become more traditional, like end up taking traditional drugs and herbs. And others resort to prayer. Yes, prayer is very important. Myself, I'm born again. I believe in prayer. But you'll find that, yes, pray. But then it's always good to seek medical attention so that those doctors whom God also created and enabled to learn and to be specialists in these matters can be able to be of help. God can use them in your healing, in the treatment of your condition. So usually education will change behaviors and improve individual and community health. So it's an important aspect that is key. Then you have religious systems. I've already mentioned. You'll find that usually with religious systems, they'll promote or impede health. And some factors such as smoking, alcohol consumption, pre and extramarital sex are condemned by most religious bodies, while some religions are against treatment in hospitals. So there are those that promote and others impede or negate, or rather bring down matters of health, deteriorate issues with health, especially those that would discourage its members not to go to hospitals for treatment. That is not good, because it's always important to have our bodies checked. So many religious organizations promote issues that directly or indirectly support, such as hygiene, ban on alcohol and cigarette smoking, and also marinating chastity. Um, then we have the environmental system, whereby we just want to ensure that our communities are having proper sanitation, which is an important indicator for community health, clean water supply, proper disposal of waste and excreta, and also good housing, which are key community wellness aspects of community wellness. And if the environment is interfered with in any way, you'll find that many diseases may crop up. So, for example, if the community water sources are not protected, members are predisposed to water-related and water-washed and waterborne diseases like cholera, dysentery, and maybe you can name some more that you know of. And if the houses are poorly constructed in terms of ventilation and airing, then people become prone to respiratory conditions. Like if one person develops TB, then it's likely to spread to other members within that community. So there's also the communication and transport system, whereby it includes all the means of exchanging information, uh, telephone, TV, radio, and also fax, internet. So communication is very key, and right now with mass media, it will promote widely the use of passing on health messages, while transport helps people to move from place to place. And good road networks facilitate fast transport of the sick to hospitals, food products to the market, and such like. So how do you encourage the community to be involved in the promotion of their health? Maybe this one tell me when we meet in our class. I hope that we shall interact more as we engage in this and through the first topic. So basically, what we've learned today is the introduction to community health, and we've basically looked at the introductory part, and also we've looked at the definition of some terms. We've looked also at the concepts, and finally we've looked at the subsystems that exist, the concepts that exist in community health, and these subsystems are actually 6 in number, and you need to acquaint yourself with them. So about how we can encourage community members to promote their own health, it's a matter that we can discuss in our class, and some factors that will promote good health in the community. So I look forward to seeing you in the class. Have a nice time and enjoy.